Okay. A 65-year-old man has chest pain. On initial assessment, he is noted to be pale. An ECG reveals no connection between P waves and QRS complexes with a rate of 42 beats per minute. What's the single most likely diagnosis? A. Complete heart block. B. Ventricular tachycardia. C. First degree heart block. D. Mobitz type 1 AV block. And E. Mobitz type 2 AV block. And the answer according to the patient's sign and symptoms, there is no any connection between P waves and QRS complexes, and the patient is also bradycardic. The answer will be complete heart block. And here we are going to explain different types of heart blocks. First degree heart block is a prolongation of the PR interval beyond 0.2 seconds, and it's a benign condition that does not require additional follow-up or any management, and it will not cause any problem in the future. As we can see here in this ECG, first degree heart block, we have increase in PR interval, but the rest of the ECG is normal. As we can see here we have the increase of PR interval beyond 0.2 seconds. And second degree AV block, we have two types of second degree AV block: Mobitz type 1 or Wenckebach and Mobitz type 2. Mobitz type 1 or Wenckebach, the PR interval gradually lengthens with each heartbeat until a beat is completely dropped. This is often associated with a progressive prolongation of the PR interval. As we can see in this ECG, we have here the progressive prolongation of PR interval until we have a beat drop here. We have progressive prolongation of PR interval. Here PR interval is prolonged, and here the prolongation is increased, and here we have a drop beat, and this is the characteristic for Mobitz type 1 and Mobitz type 2. In Mobitz type 2, the PR interval remains constant before a beat is dropped. The blocked beat occurs without any prior prolongation of the PR interval. As we can see here, the P wave, but here we don't have a QRS complex. Here we have constant PR intervals. The PR interval is not prolonged and it's constant. Here we have three normal beats, but here we have P wave, but it's not followed by a QRS complex. And here we have a drop beat. And the point is the PR interval is constant and it's not increased. And it's the characteristic for Mobitz type 2. And third degree or complete heart block. It's a serious condition where the electrical signal between the atria and the ventricle is completely blocked, leading to a slower and potentially irregular heart rate. As we said in the patient history, there is no any connection between QRS complexes and their P wave, and the patient was also bradycardic, and it's the characteristic for third degree or complete heart block. As we can see here, here we have QRS complexes, and here we have P wave, QRS complexes, P wave, QRS complexes. Their atria are walking separately from the ventricles, and there is no connection between the electrical signals is completely blocked, preventing communication between the atria and their ventricles. The ventricles are walking separately from their atria, and this is the characteristic for third degree or complete heart block. And Mobitz type 2, we have here a very important note, and the patients with Mobitz type 2 and complete heart block requires permanent pacemakers because it's a very life-threatening condition.